And on behalf of the Black Coalition Against COVID, Howard University, the Health Alliance Network, and blackdoctor.org, and other organizations, we welcome you, Tony. How are you?
Very well, thank you, Mr. Lane.
A very recent Pew Research poll and other polls taken. So, for example, blackdoctors.org also took a poll on their website, but they have indicated a reluctance by the Black community to participate in vaccine trials or to take the vaccine once it is available. The immediate question is around mistrust. Mistrust of the state, mistrust of white people, mistrust of the medical community, and so on. You generally hear of the Tuskegee syphilis experiment and Henrietta Lacks, but it is rooted much deeper. From slavery to Jim Crow, to the targeting of Black leaders in the 60s, to police brutality and uneven court justice, to Black Lives Matter, and now to the disproportionate impact of COVID on the Black community. While at the same time, there is recognition of Black progress made in society, not just in arts, entertainment, and sports, but also in education, business, and science. The poll shows an almost even split between Black people who will take the vaccine and those that won't. And it cuts across economic position. In addition to all of those issues, all of the peeling back that layer of the onion, the whole country has been fed misinformation and sometimes outright lies about COVID-19 and vaccination. So my first question, which is a tough question, is why should Black people trust this process?
To point out that the speed has nothing to do with compromising safety or scientific integrity. It's due to the extraordinary and exquisite advances in vaccine platform technology, which has allowed us to do things in weeks to months that formerly took years, several years, and to engage in a dialogue and talk about that as opposed to just feeding it to them. The second thing is, well, how do I know that this vaccine is really safe and is really effective? Is this just some government ploy? We've been fooled before by the federal government. You gave some very cogent instances just a moment ago. Well, or is it the pharmaceutical companies that want to get rich over us? Well, we can address both of those. First of all, the determination of whether a vaccine is truly safe and effective is not made by the company indirectly, and the government doesn't see the data at all until way down the process. The data first come to a totally independent data and safety monitoring board that is made up of experienced clinicians, scientists, vaccinologists, statisticians, and ethicists. They look at the data and they independently determine if it's safe and effective. If it is, they show it to the company. The company then analyzes it and presents it to the FDA and applies for an emergency use authorization or outright approval. The experienced career scientists, not the politicians, the career scientists in the FDA examine the data and then, in association with their own advisory committee, the Vaccine and Related Biological Products Advisory Committee, or VRBPAC, those individuals then advise the FDA. When they then say that the vaccine is safe and effective, I will tell you all that I myself will be perfectly comfortable in taking the vaccine, and I would recommend it to my family. So it really is a process of trying to dissect out what the reasons for the skepticism are and to try and address them individually, fully respecting the underlying skepticism that you have every reason to have for historical reasons, to balance those two. That's how I would approach it.
And my understanding is that that independent monitoring board has African-American scientists on it. In fact, one works with you directly. I don't know if she's on the board, but we know that we have an African American scientist that works with you directly. And so this is, and talk, you can speak about her work, but also how important that is in terms of breaking down these myths in the historic trepidation, because it's a new day. It's not 1930 anymore. This is 2000. This is 2020. And so the times have changed, and the input of African American scientists in this process is much deeper than one might think. Talk about that a little bit.
Well, I think the example that you gave, Ambrose, is an excellent example. The very vaccine that's one of the two that has absolutely exquisite level, 94 to 95% efficacy against clinical disease and almost 100% efficacy against serious disease, that has shown to be clearly safe. That vaccine was actually developed in my institute's vaccine research center by a team of scientists led by Dr. Barney Graham and his close colleague, Dr. Kizzmekia Corbett, or Kizzy Corbett. Kizzy is an African-American scientist who is right at the forefront of the development of the vaccine. So the first thing you might want to say to my African-American brothers and sisters is that the vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact. I mean, that is a fact. And I think that's some of the things that people don't fully appreciate.